animals. This is hungry people. These people are looking just for food. Please, I don't think Ramaphosa is doing something good. Why not? Then we can rather die of coronavirus than to die in our homes of hunger.
Defiance over South African President Cyril Ramaphosa's strict lockdown. Protesters say his measures are leaving millions of people struggling to support themselves. Like many other Africans, they've been left with a choice: hunger or infection. Only a tiny fraction of the continent's total population is infected, according to official figures, some 24,000 confirmed cases. But health systems are fragile, poverty is high, and many more face starvation. I'm Ben Fazulin. Africa's got so much more to deal with than this virus. Unrest, famine, even deadlier diseases. And severe measures to contain COVID-19 are leaving so many people fighting to survive. That includes South Africa's huge migrant population. A nationwide lockdown means those running businesses need to apply for permits that are mostly off limits for foreigners.
The corona outbreak is a battle for survival for this Zimbabwean family in downtown Johannesburg.
We are 7, and because of this lockdown situation, we are real starving. We've run out of food, and then I'm trying to sell this little bit of spinach so that I can put a little bit something on the table for my family.
A 5-week lockdown brought most businesses to a grinding halt, including the restaurant where Nkazimolo Khumalo eked out a living for the last 9 years. But he needs a permit to sell, something that he doesn't have, forcing him to sell illegally.
Because I'm an illegal immigrant, I cannot manage to get the permit to sell even this spinach. So that's why I decided to sell outside my building, so that even when the police they come, I easily run inside my building.
The country's informal sector provides up to 2.5 million jobs. But the government put strict restrictions in place during the lockdown and threatened some with legal action.
There were a lot of exclusions, such as undocumented migrants and people without existing trading permits. This is a problem because members of society who were already vulnerable before the lockdown are the ones who are now paying the highest price for the lockdown.
Army and police scour the streets day and night to enforce social distancing and arrest people loitering. Meaning both selling and buying in the informal sector carry a massive risk.
I'm buying here from my brother because we are all immigrants from Zimbabwe. It's really tough because there is no food. We are not working. We are trying to support each other. We are stuck here in this country. We cannot go back.
Khumalo hasn't had a good day. He's only earned €3 to feed his family.
Hey, today could not even make enough money, so we're gonna manage only a little bit of porridge, because today it was no business.
With the lockdown extended until the end of April and food already running short for many, analysts say social unrest is all but assured.
Well, the pandemic may have been slow to reach Africa, but the number of cases is increasing fast, jumping by over 50% last week. There are now almost 24,000 confirmed cases across the continent. Northern Africa has seen a significant outbreak, with hotspots forming in Morocco and Egypt. South Africa is worst affected, with some 3,000 official infections. That high number is due in part to the country's aggressive testing regime. That's critical to protecting South Africans' health, but is stretching laboratories to their limits. Africa health expert and entrepreneur Ernest Darcourt joins us from Cape Town. You helped pioneer Africa's first HIV treatment rollout in Botswana. You've advised numerous governments. How's the continent dealing with this outbreak?
Well, as you've just been highlighting the systemic deficits that exist in the continent in terms of tackling gargantuan pandemics such as this, um, you can see, treatment is not an option, right? If you compare the kind of resources and infrastructure you have in, for example, Europe, where they are struggling, where they have about 4,000 beds per 1 million people. That's 4,000 critical care ICU beds per 1 million people. Africa has maybe about 5 beds per 1 million people.
Wow.
If you look at certain countries like South Sudan, for example, you have a population of 12 million people with 4 ventilators, according to the IRC. So we have to get prevention right. And that is why you'll see in most African countries, in particular with the example of South Africa, leading with a very aggressive lockdown is really the way to prevent this thing from taking hold. Because if it does take hold, as it has in some of our Northern European counterparts, it would be absolutely devastating. And so, as difficult as these issues are, these are structural challenges that have long existed. And I think COVID exemplifies why we should have addressed them earlier. But since COVID is here now, it's going to be a delicate balancing act between making sure we get prevention right while taking care of the vulnerable populations.
What about preventing the unrest, though? I mean, that's going to be the main challenge here. We've got millions of people facing hunger. Locusts have destroyed entire crops in regions, and now these lockdowns.
Well, yes, exactly. And I think knowing that there's obviously scarce resources to deal with health, there's also scarce resources to deal with things like food, hunger, providing electricity or energy to people. And so when you have scarce resources, and you have such massive wide-scale challenges, the first thing you need is data to understand where do you have the biggest deficits so that you can deploy your scarce resources most effectively. And I think the imperative, therefore, right now is for African countries, including South Africa, to really be able to quickly pinpoint the spots where there's going to be trouble based on poor fundamentals being in place, lack of water, lack of electricity, high poverty, et cetera, and get in there to provide the social mitigating programs that are required so that people can actually adhere to the criteria that will ultimately protect us all.
Talking about data briefly, you've launched a mobile app to stop the spread of COVID-19. How could it ease the situation?
It gives you real-time information about what's evolving. So it allows you, on terms of the population side, to screen people, geomap whether you found an actual case or someone who's suspected, also to find at-risk populations, people who are at risk, meaning they're not infected yet, but they have diabetes or hypertension, and we know those are predisposing risk factors, and to be able to therefore protect them from getting infected by making sure, for example, they self-isolate, et cetera. But more importantly, it's giving you data on what's going on in the community in real time. So, for example, if people say we don't have water or food, this is in essence a direct red-hot telephone line to say get in there and provide these things so that people can actually adhere. So, for example, if you don't have water, you can't do the hand washing. If you do not have electricity, you cannot keep disposable food in your fridge for long enough, to be able to actually not have to go out frequently to get it. And then if you don't have work because of the lockdown, you don't have money to afford food or electricity. So it really is imperative that it's a holistic approach. It's not just viewed as a clinical issue.
Sure.
The social determinants are as aggressively dealt with as the clinical issues.
Ernest Starkor, thank you very much for joining us.
My pleasure.
Now to our viewer questions on the coronavirus. Our science editor, Derek Williams, has the answers for you.
Who came up with this lockdown idea?
Although lockdown feels like an unprecedented step to us at the moment, confinement is actually a tool that's been used for centuries to contain epidemics. That's because if you lack access to drugs for treating an infectious disease or a vaccine to prevent it, limiting how much people interact with each other is pretty much the only way to slow its spread. Many of the measures that we're seeing today, including things like closed borders, contact tracing, or social distancing, were first attempted in the late Middle Ages and Renaissance by Italian city-states, desperate to mitigate the effects of the plague. Waves of it regularly killed huge numbers of people there. Throughout the centuries since, lockdowns have been employed time and again when infectious, deadly diseases left societies with no other recourse.
Can we eliminate the virus completely?
Well, this would be the ultimate goal, right? But don't expect it to happen anytime soon. We've eradicated infectious diseases before. Just think smallpox. We even managed to eradicate another zoonotic coronavirus, SARS, after it broke out in 2002. But there's a key difference between it and COVID-19. People who get COVID-19 can infect others before they start to show symptoms themselves, so during the incubation period. That wasn't the case with SARS. COVID-19 is much more transmissible, and that characteristic is what's going to make it very difficult to get on top of this disease. Most experts agree at this point that COVID-19 is likely with us to stay and will probably turn into an endemic background pathogen like flu bugs.
Which country in Europe has the most cases of COVID-19?
Well, currently Spain has more confirmed cases of COVID-19 than any other European country, although more people have died from the disease in Italy. But we should always really take statistics like this with a grain of salt because both testing and record keeping vary a lot from country to country. We haven't agreed on any international standards for who is to be tested, and we don't even agree on what constitutes a death by coronavirus. Because testing capacities are limited, most countries are only testing people who are presenting at centers that have clear symptoms. In countries where testing is more widely available, people with few or no symptoms might be tested. And that could make a huge difference in the number of cases that are detected. So it's important to remember those differences when trying to compare what's happening in one country with what's happening in another.